Medical Solutions has actually been very good. They are, because I'm at a major university, we see all the companies. We have representatives from each of the companies come in, new companies, established companies, and we like to try as many companies as possible. So over the 20-some years I've been at Temple, we have tried for compression therapy most of the major suppliers in the Delaware Valley, and we continually come back to Medical Solutions because they're faithful, and they are effective, and they are actually very cost effective and helpful to the patients. So we have very few patient complaints. There is absolutely no such thing as no patient complaints if you deal with human beings. But we have inner city population is a tough population, and I think to see a company that's been as good as Medical Solutions at dealing with that, I think they've been terrific. If you have your mind closed, you're not going to be able to accept anything. So open your mind a little bit. Try some of the newer available compression pumps. See if you start to get a little better result from a good segmental compression device that has the appropriate number of chambers and the appropriate amount of compression. And work with a company like Medical Solutions. They're not may mean they're not available everywhere, but they certainly are available in this area. Work with a company like that to make sure that you're getting the right device, that the patient gets the right education, and that they get the right encouragement and support to use the pumps. There are a ton of people that go through all the trouble to get them and then put them on a shelf. And they don't get enough encouragement from their physicians and their physician staff, and also from the supply companies to check up and give them a little pep talk and make sure that they're using the devices. So there's a lot of things that go into an effective administration of a therapy, and that's essential for the use of segmental compression pumps. In order to see the benefit, they have to use them, and they have to use them for a long time. Like, these are long-standing changes in the circulatory system and the skin and the subcutaneous tissues. And so in order to change that situation for patients, they have to use a device like this for many weeks. This is not like, oh, I just get better. It takes, just a sprained ankle takes 4 to 6 weeks to heal from. So something like this, where the whole limb has changed, the skin has changed, the coloration of the limb has changed. They've developed multiple wounds, they've had infections, the lymphatic system doesn't work correctly anymore. In order to reverse that, it takes a long time. So constant, faithful use of the devices. And then constant reinforcement and support from the physicians that order these is essential for them to work and for the patients to really believe in them. Because even vitamin therapy is a perfect example. If you take a vitamin to correct an imbalance in your system, you don't feel anything at first. Well, maybe some people do, but the majority of people don't feel too much. And as you take a vitamin for a period of time, you begin to get the nutritional benefits of it and begin to actually feel, more alert, more energy. Those kind of things happen with time. And if you gave up on it on the first attempt, you just would never feel the benefits. Same thing with segmental compression pumps. Nothing's the greatest thing since sliced bread. Every time somebody tells you, like, I got the best, the newest and the best and all these kind of things, everything has limitations and everything has good points and bad points. But for the amount of benefit that you can get from a device that is relatively inexpensive compared to other medical things and other medical interventions, and is relatively effective if used properly. This is an excellent therapy for patients, and I really don't think that I don't think you should shortchange patients by saying, one, just assuming they won't use them, because you'd be surprised how many patients will actually step up and use a device like this once they begin to see some improvement. Or that because there's a lack of literature out there to support it, that, particularly the RCT studies or the more head-to-head studies with different therapies. And this is true in all of wound care. There are very few products in wound care that have a great deal of randomized control trials to support what they do. And yet they are effective, and we know they're effective, and we've seen them clinically be effective. And I have seen, you know, this type of device be clinically effective time after time after time. So the fact that there are not as many RCTs for segmental compression as there are for, you know, compression wraps doesn't necessarily mean that these devices are that they don't work at all, and that they may definitely have a real place in management of lower extremity edema.